Hi there, I'm Infinity and I'll be conducting your eye exam today. How are you doing? Good. Okay, so please take a seat and we'll begin. Okay, so you are in today because you received our letter. Great. Yeah, when you're part of our lens subscription program and you receive your lenses monthly, we do need to see you every year to make sure that anything that might have happened to your eyes is okay and that there's no changes to your vision and so on. It's really important. It's good that you came in. Okay, great. So we'll be quick today. I'll just confirm your contact details, make sure we have everything. Then we'll do a quick history. Okay, when was the last time you were here? Yeah, that's what I thought. Okay, so since you haven't been here in a little while, just repeat your history again to make sure we know everything we need to know, okay? Great. And then after that, just have a chat with you about your contacts, make sure everything's up to scratch, and after that we'll proceed with the exam. So the parts of the exam will be just testing your peripheral vision, making sure that everything's okay with your vision, and then I'll come in a bit closer, examine your eyes, and we'll do a few light tests as well, alright? And then afterwards we'll have a chat, make sure that anything we discover, any complaints you have are addressed. And if there's any treatments that you need or any kind of follow-ups, we'll schedule it then, okay? Perfect, great. So let me just confirm your contact details to make sure that we have up-to-date ones for you. Can you just confirm your address for me? Great. And your contact phone number, please. Same one we have on file, perfect. And do we normally contact you by email as well? Could you just spell out your email address for me? .org? Perfect, lovely. Good, so let's proceed with your eye history and just ask you some simple questions, alright? And you tell me the answers. Perfect. Have you been experiencing fever or fatigue lately? Yeah. How long ago was that? Just the flu? Okay, but no, otherwise no special amounts of fever or nothing like that? Okay. And have you seen any vision changes happen lately? So it could be blurry vision, any vision loss, seeing double, anything like that. Great. How about headaches? Have you been having any headaches lately, last 6 months or so? And how frequently would you say that would be? And on a scale of 1 to 10, what would you say is the intensity of the headaches? Okay. And is that primarily during work hours? Alright. How about dizziness? Any dizziness? Any lightheadedness? Good. How are things on the emotional front? Any depression, anxiety, any trouble sleeping? Anything happen in the family? No? Good. How about rashes and itching? Have you experienced any rashes or itching anywhere in your body really, but especially on your face or around the eye area? Good. Have you had any bleeding or bruising? Do you bruise quite easily? Okay, so nothing out of the ordinary. Alright, very good. Do you have any allergies? It could be to food, hay fever, any medication. Good. Speaking of medication, are you on any medication recently? Have you come off on any medication recently? Come off medication. Okay, and how long did you take that for? And that's for, yeah. Okay. In terms of your family or close relatives, is there any history of glaucoma in the family? Okay, what about cataracts? Okay. What side is that on? And what age? Okay, and was there surgery as well? Okay. Thank you. And does anything else come to mind with your family? Any other eye or vision related issues? Great. Well, let's talk about you. What's your occupation at the moment? Ah, very interesting. And I assume you work with the computer quite a lot? How many hours a day would you say? Okay. And do you take sufficient breaks? Sufficient would mean every 40 minutes to an hour, the ability to step away from or look away from the computer monitor. Not really, okay. Alright. Yeah, it is quite normal, it's very common, but we do recommend that you try to take some time away from the computer. Make sure that, for example, if you are working with the computer for an extended amount of time, try to focus your vision elsewhere. So it may be beneficial to look out of the window, look across the office. It's good for preventing any further issues. Okay. Are you taking any drugs at the moment? And how long ago was that? Okay. Great. And are you drinking any alcohol? How much would you say a week? Okay. Do you smoke tobacco? No. Great. Wonderful. That's what we like to hear. In terms of your eyes again, have you been experiencing any floaters? So, seeing things floating around or any kind of small objects in your eyes? Okay. How long ago was that? How often would you say that happens? Okay, in which eye? Alright. Have you been seeing any light flashes? No. Good. Perfect. So we're done with the history section of our exam. So this is something that we're going to keep around in our file for you for next time as well, okay? Now I'd like to talk to you about your contacts in particular because that's why you came in. So how's it going with your contacts? How's it been? Do you have any complaints, any comments on them? Okay. Okay, great. And what kind of contacts are you wearing? Okay. And are you wearing them today? You are. Perfect. That's exactly what we want. Perfect. So we'll proceed to the examination part of our session today, okay? So what I'm going to do is come in a bit closer to you, if that's okay. Yeah? Good. And I'll start by testing your vision. Then we'll go ahead and test your eyes. So I'll just let you know if I need you to do anything. Just follow my instructions, alright? So the first thing I'd like you to do is just cover one of your eyes with your hand. Exactly. It doesn't matter which one. That's perfect. And just follow my finger, right? Just try to follow it with your eye. Great. Great. Now cover the other eye, please. And just follow my finger once again. Okay. Keep following it. Thank you. Great. Now what I'd like you to do is cover the first eye once again. Just focus on my nose, okay? And I'm going to move my finger away and just tell me when it leaves your field of sight, okay? Field of vision. Ready? Yeah, just keep your eyes right here. Tell me when my finger disappears. Okay? And now tell me when it reappears. Great. Let's do the other eye. So cover your other eye, please. Good. Tell me when it disappears. Great. And when it reappears. Brilliant. Good. Okay. So what I'd like you to do next is I'll come in a bit more closer as well, and I'll turn the lights off. And I'm going to examine your eyes using a bit of light, alright? And all I need you to do is just look at my face and I'm going to examine your eyes up close and make sure that we see any changes, anything like that, and I'm able to have a good look at your eyes as well as the condition of your lenses, okay? Great, so I'll just turn the lights off. Okay, so I'm going to come in quite a lot closer to now. Just focus on my face here. Okay. Good. Just keep looking at my face. Okay, let's do the other eye. Just gonna come in a bit closer again. Okay. Great. Okay, so I'm not seeing any lesions, any particular signs of trauma or irritation that can occur when you rub your eyes with your contacts on or anything like that. Are you pretty good at taking them off at night? Yeah. Good. And you keep your hands clean when you do that? Good. Perfect. Your eyes do look to be in very good condition, which is great. Perfect. So now what I'd like you to do is just follow the light for me, okay? Good. Lovely. And across. Perfect. And I'm just going to make sure that your eye dilates properly. So just look at my nose, please, alright? Great. Other eye. Lovely. So I'll pop the light back on. Lovely. So far, nothing to worry about. Everything looks a-okay. And what I'm going to do next is I'm going to pop my gloves on, alright? And I'm going to examine your eyes a bit up close, move your lids around, and just make sure that we're able to see anything underneath your eyelids, that the movement of your eyelids is good, that there's no swelling, alright? So you don't need to do anything, just sit tight, and I'm going to come in very close, okay, and just move your eyelids around a little bit. Okay. How does that feel? Good. Okay. Perfect. Alright, so I'm just going to examine your lower lid here and just pull it away a little. Okay, that looks perfect. Other side. Good. Okay. Let me just feel around your face as well. Make sure this area. How does that? Everything okay? Yeah? No swelling. Good. I'm just gonna make sure there's no secretions coming out. If anything, I would say your glands look a slightly tiny bit blocked. Would you say you experience any dryness with your contacts? Yeah? Okay. Alright. So the last thing I'm going to do is just take your contacts out, and I'm going to put them in a container. Then what we'll do is I'll spray a little bit of a dye in your eye. It's nothing to worry about. It's going to dissipate very quickly. But what it will do is it'll highlight and contrast any areas or any concerns that I might have about your eyes, okay? So I'll just hold your eyes open, spray that in, and just examine your eyes one more time. But before I do that, let's take your contacts out, okay? I have a case here that we can use. So if you don't mind, I'm just going to come in and take your contacts out for you and just use this solution to store them, okay? Alright, so let's just do this eye first. Okay, it's okay to blink, don't worry. Okay. First contact here. Yeah, you can keep this or you can pop them straight back in after the exam, okay? Second eye. Okay, there we go. so now just keep your eyes open for me. Let's pop this eye open like this, and I'm just going to spray this dye inside, okay? Great, that's one. Just blink. Perfect. Second eye. Blink. Great. Let me just come in and have a look. Again, with the light, just look straight at my face. Okay. Great. Great, so nothing to worry about today, other than, as I said, a little bit of redness. And I think that's for the dryness that you're experiencing. So can you tell me more about that? How often would you say your eyes get dry? Okay. And you've been reducing the amount of contact wear that you get out of your contacts because of that, right? It makes sense if you're experiencing discomfort. Okay. So what would you say do you feel in terms of dryness from 1 to 10? How bad do you think it is? Okay, so quite severe. And in terms of any itchiness or burning sensation, would you say you've been feeling any of that? A little. When you insert your contacts? Okay. So the burning sensation when you insert your contacts is probably a combination of the dryness together with the solution, the match of the contact solution you're using to your eyes, okay? So what I'm going to do is give you a sample of this sensitive eyes solution that you can use, and I'll give you the big one so you can have at least a month of trial of this, okay? So use this exactly the same as your current solution, nothing to change at all, and you should be seeing a little bit of an improvement. But I'd also like to think about what we can do in terms of the dryness as well, because like I said, I saw a bit of blocked glands on your tear line. So your eyes, they produce tears in order to lubricate your eyes, and they also produce oils through glands that mix with your tears, and they help to lubricate your eyes further. And what I've seen when examining your eyes is that some of those glands appear to be blocked at the moment, okay? So what I'm going to do is give you a treatment for 10 days. We'll schedule a follow-up appointment for you, and then after 10 days we'll see how you do. So I'll just explain what's going on there a little bit. So this is your eye right here. This is the back of your eye, and then obviously here you have your pupil and your iris and your cornea. This is where your contact lens goes. This area right here is actually exposed to air, to pollution, to makeup, to skincare, everything that you're using, soap, So what can happen is this area can get irritated and it can get sensitive. And so what we need to do is make sure that any of the glands or any of the eye mechanisms are working in their right way to lubricate the eye and make sure that it's protected from the environment, all right? So what I'm going to ask you to do are 3 steps. 1, 2, 3. Okay? Step 1, what you're going to do is you're going to take something like a makeup pad, okay, something simple like this. You're going to soak it in warm water, and then take 2 of these at a time. Do you have some at home, or do I need to give you some? You have some? Perfect. Take 2 of these at a time. Soak them in warm water, not too hot. Then apply them to your eyes, okay? And keep them there for 5 minutes at a time. And this is a warm compress you're going to do. What this is going to do is loosen the debris, and I'll give you the sheet so you can follow it at home. Loosen any debris, which is going to then help you do a lid scrub, which is the purpose of this treatment. I'll show you how to do that in a minute. And what it's going to do is warm up the fatty contents of your glands in your eyes, okay? It's going to make them easier to move around. It's very important you do this step, okay? If you skip any of these steps, this treatment is not going to work very well. Understood? Good. Second step you're going to do is a lid massage. So what you're going to do is close your lids, And you're going to take your finger, make sure you wash your hands, take your finger, and then you're going to massage in circular motions upwards on your lower lid and downwards on your upper lid on each eye. Okay. And this is going to loosen any of your gland content. It's going to make sure that it's movable. So now you've warmed it up and you moved it around. What we now want to do is take out any debris and any of that content out. And the way we're going to do that is by doing a lid scrub. So I'm going to give you these lid wipes. There are 20 here. So you're going to do this twice a day for 10 days. Just open the box. Take out a wipe. This is after you've done your compress and your lid massage. These are sterile wipes. You take out one at a time, and then you wrap it on your finger, and you just want to pull down your lid and just wipe inside of your tear line. All right? And so this will help you to reduce and prevent any inflammation and also help with any blockages that you currently have. Okay? Do you have any questions? Yes, that's twice a day. So in the morning and in the evening is best. All right? And then the other thing I'm going to give you is some eye drops as well. These eye drops are very, very good for lubricating your eye, and you can use them up to 4 times a day. Use them in the morning and in the evening, 5 minutes after you finish your lid scrub. And then at your discretion, you have 2 more times during the day when you can use these as well. If your eyes get dry, especially at work, working with the computer. All right? So I'll put all these in a bag for you. You have your eye drops. You have your eye wipes. And your contact solution. And I'm also going to give you a copy of these instructions here. Okay? And you can pay for these at the till on your way out. There you go. You're welcome. Do you have any other questions or any concerns? Great. So, perfect. So then I will schedule your appointment for next time. We need to come in 10 days, so that's going to be the, yeah. And how about 3 o'clock again for you? Perfect. Yes, so we have your number, so you'll receive an SMS reminder, and I'll see you then. Perfect. See you soon.